Welcome to our book club. You voted on what book for me to read and summarize, and this book got so many votes. Hi, I'm Dr. Teresa Lyons. I teach parents the cutting-edge science of autism so that you can make the best decision for your child based on quality information. In this video, I will go over what the vagus nerve is and discuss the physical observables if someone has issues with their vagus nerve. We will focus on behaviors like digestion and a variety of the big autism observables. This is a great book that really explains in a very easy way the vagus nerve. And in the second video, what I'm going to do is talk about how you improve vagus nerve function based upon the book. I'll go over the exercises that are in this book, and they have some really great ones that you can have your child do in therapy. These are great ideas to ask your child's therapist, okay, how about we try something along this way? Anyone can benefit from these exercises, so you could even do it with your child if you want. You don't have to, but plenty of ideas and exercises, things to do that will really strengthen the vagus nerve. Let me go get my slides so that if you're a visual learner, you can see what I'm talking about. And if you found this video to be helpful, please hit the like button and also subscribe to my channel to get the cutting-edge scientific information about autism so that you can make the best decisions for your child based on quality information.
This is a great book about activating your vagus nerve. This video, we're going to learn about what the vagus nerve is and what it controls. And then the second video is all about how you stimulate it. What is the vagus nerve? The vagus nerve is the longest nerve in the body. It originates in the brainstem, and the brainstem is responsible for automatic functions of the body, aka the autonomic nervous system. Functions of the autonomic nervous system include beating of the heart, breath rate and depth, blinking of eyelids, detoxing in liver and kidneys, digestion, produce saliva and tears, constriction, dilation of blood vessels, sweat glands, pupil dilation, constriction, urination, and sexual arousal. How does that work? That's a lot for one nerve to be involved in. There are two types of neurons. Afferent neurons take information from the body to the brain, and that's the majority of the flow of the information. So the body is communicating to the brain what's going on. And efferent neurons take information from the brain to the body. The information flows two ways. This is a bidirectional highway of information. Neurotransmitters is how the brain communicates. Acetylcholine is a neurotransmitter used most by the vagus nerve, and it has a major anti-inflammatory effect in the body. All right, we know the vagus nerve starts in the brainstem, but where else is the vagus nerve? It goes into the neck, and then into the chest area, and then the abdomen. And here's a picture from the book that shows all the intertwinings into the organs that the vagus nerve is involved in. The vagus nerve is the largest nerve. It is involved in so much in our body. And as you hear me explain what the vagus nerve does and what happens when the vagus nerve doesn't operate optimally, you might start thinking about certain symptoms of your child with autism. The functions of the vagus nerve. The vagus nerve is the conductor of the body. So think of an orchestra, think of the conductor. The conductor is really having everything move optimally. Everybody's looking to the conductor as to what to do. When the conductor is not operating functionally, there can be quite a bit of problems, right? And it doesn't have to be universally the same problem for everybody. Here are the functions of the vagus nerve: sensing skin of the ear, allowing food to be swallowed, managing your airway and vocal cords, controlling breathing and heart rate, maintaining optimal blood pressure, controlling the many functions of the liver, gallbladder emptying, managing hunger and satiety. This is a big one for some people with autism, not every person with autism, but for some. Managing blood sugar and insulin levels, release of digestive enzymes from the pancreas. This is another hot topic for those with autism, digestive enzymes and really having optimal digestion. Managing gut motor function, managing activity of the immune system, managing inflammation of the gut, relaying information from the microbiome to the brain and elsewhere in the body. These are a variety of functions of the vagus nerve. The book goes into detail about each of these topics. So if you're certainly interested in a particular topic, I recommend go buying the book and reading the section on it. But this is how important the vagus nerve is. How does the vagus nerve affect autism? In autism, many times there is less than optimally functioning of the vagus nerve, which is why some of those functions are health issues for those with autism. Not every single one of those issues are an issue for those with autism, right? There's variability here. The vagus nerve has many functions, so it's possible for one person with autism to experience things differently than another person with autism who has different vagus nerve health challenges, if any. You can see this is where the variability comes into autism. What disorders affect the vagus nerve? Disorders that have high inflammation. So the vagus nerve is really controlling the whole body, right? But it's also controlling inflammation. If there's a high level of inflammation, that's typically when we start to see disease, and that's when diagnosis can be made. So what disorders besides autism that can affect the vagus nerve is Alzheimer's disease, arthritis, asthma, cancer, Crohn's disease, diabetes, heart and cardiovascular disease, high blood pressure, and other conditions that end in the suffix itis. And so this is the part of the book that does the background, that talks about what it is, where it's located, what functions does the vagus nerve oversee. Many questions become about, all right, how do you have the vagus nerve be optimally functioning? And so there is something called vagus nerve stimulation, and how that's involved with autism and epilepsy. This is a quote pulled from a publication directly, not the book. This is a publication, scientific publication. Vagus nerve stimulation is a safe and effective therapy for pediatric patients with drug-resistant epilepsy. However, in children with drug-resistant epilepsy, the effects of vagus nerve stimulation on autistic behaviors remain controversial. So this is a new area. It's not extremely well studied. And in the next video, I'll go over different ways that the vagus nerve can be stimulated and activated from a more holistic standpoint. And here are some references. First reference is the book from the book club, and the second is scientific journal article about epilepsy, vagus nerve stimulation, and autism. Check out part 2.